Picture this scenario for a second. Um, you have just gotten home from a really long, exhausting appointment at the doctor's office.
Oh, we've all been there.
Right. You are tired, your mind is just swimming with all this dense medical terminology, and you pull a new prescription bottle out of that little crinkled paper bag.
Yep.
So you set it down on your kitchen counter, and you just stare at it. And it is covered in that incredibly tiny, densely packed text that honestly seems designed to be completely unreadable.
Oh, absolutely. Or, worse, you are holding a physical paper prescription and it is written in that stereotypical, completely illegible doctor's handwriting.
Yes, exactly. You find yourself squinting under the kitchen lights, genuinely wondering, wait, did the doctor say to take this with food, or was it strictly on an empty stomach?
It is a remarkably universal and, frankly, a really frustrating experience.
It really is.
There is this sudden wave of anxiety that hits you in that exact moment. Because, you genuinely want to follow the medical advice perfectly, but the actual communication medium, like a tiny adhesive label or a hastily scribbled note, is actively working against your ability to do so.
Right, it's counterproductive.
Totally. The cognitive load of just being a patient is already so high, and deciphering basic instructions shouldn't be the hardest part of your recovery.
Well, that specific anxiety is precisely what we are diving into today, so welcome to the deep dive.
Glad to be here.
Today we are exploring a UK-based company called VocalTrace, and they're essentially attempting to take those confusing physical medical documents and transform them into smart, voice-enabled records.
Which is a huge undertaking.
Yeah, it is. Our sources for this exploration include VocalTrace's official LinkedIn company profile, as well as their highly detailed product overview, which, by the way, is brilliantly titled Intelligence on a Sticker.
I love that title.
Me too.
The mission for our analysis today is to really understand this bridge between the physical and the digital worlds. Like, how does the unbelievably simple act of putting a sticker on a bottle attempt to span this massive and frankly dangerous gap between old school physical clinical notes and modern digital care?
Right, without making it too complicated.
Exactly. Crucially, how do they manage this without overwhelming either the patients or the busy medical staff with a steep learning curve or complicated new technology?
Okay, let's unpack this. To truly understand the impact here, we need to look at what this technology actually is on a functional level.
Right.
And honestly, it is surprisingly low-tech from the user's perspective. The core product VocalTrace provides is literally just a roll of pre-printed QR stickers.
Yeah, it sounds almost too simple.
It really does. They operate on what they call a stick, scan, and save model. You peel it off, you stick it on, and you scan it. It's essentially like leaving a secure digital sticky note on your medicine bottle.
The design philosophy there is really rooted in elegance and simplicity. I mean, they aren't asking hospitals to rip out their entire physical infrastructure.
Which would be a nightmare.
Oh, total nightmare.
Right.
Or to abandon their current paper workflows.
Yeah.
These stickers just arrive on a standard roll. A clinician simply peels one off and applies it to literally any existing hospital stationery.
Like what?
That could be a GP referral letter, a pathology receipt, or just standard medication packaging.
But wait, so no new software at all?
None.
I mean, hospital IT departments must love the idea of not having to install anything, but how does that actually work in a vacuum? Like, without turning into floating disconnected data?
That's the big question.
If a clinician just uses a standard smartphone to record an encrypted voice note, how does this function without fully integrating into a hospital's massive, centralized electronic patient record database?
What's fascinating here is that completely bypassing that complex IT integration is actually their biggest strategic strength.
Wait, really? By not integrating?
Yeah. If we look at the corporate profile, VocalTrace is a privately held company based in London, and they only have 11 to 50 employees.
Oh, wow. So they are pretty small.
Very lean. So if they attempted to build custom software that had to perfectly sync with every legacy electronic medical record system across the UK...
Oh, they'd never finish.
Exactly. They would be tied up in red tape, compliance audits, and development hell for a decade. Legacy hospital databases are notoriously fragmented and really difficult to interface with.
So they just step around the legacy systems entirely.
Precisely. By existing on the physical sticker and relying on secure, independent browser-based platforms, the barrier to entry drops to practically zero.
Okay, that makes sense.
The mechanism is straightforward. The QR code acts as a secure hyperlink. So when the clinician scans it with their phone, it connects to VocalTrace's isolated cloud servers, not the hospital's local network.
Got it.
The clinician records the audio, The cloud encrypts it, and then it links to that specific QR code's unique identifier. The hospital network is literally never touched.
Wow. So a clinic can literally just buy a roll of stickers, hand them to their staff, and start using them the next morning.
Exactly.
That significantly democratizes the technology. And for you, the patient, the process is equally frictionless. I mean, when you get home, you just scan that QR code with your own smartphone camera.
Yep, just a regular phone camera.
It opens a secure web page that plays the audio and shows the transcribed text. And the sources heavily emphasize that no app download is required.
That no app download feature, it really cannot be overstated from a user experience perspective.
Why is that such a big deal?
Well, when you force a patient, especially an elderly or, cognitively vulnerable patient, to navigate an app store, create an account, remember a password.
Oh, right. The password resets.
It's exhausting.
Yeah.
And they have to learn a completely new user interface. You lose a massive percentage of your target demographic right at the starting line.
Yeah, they'll just give up.
Completely. By making it entirely browser-based, they have removed the primary friction point of digital health adoption.
That is huge. But now that we understand the cloud mechanism behind the sticker, we really need to shift our focus to why it is actually necessary on a clinical level.
Right, the actual medical application.
Because this isn't just a clever gadget. It is specifically targeting dangerous communication gaps in healthcare delivery.
Let us examine the most obvious and historical danger, which is the handwritten clinical note.
The famous doctor handwriting.
Yes. VocalTrace explicitly highlights how their voice-enabled prescription stickers eliminate the risk of illegible handwriting entirely.
So how does that work in practice?
Well, when a clinician speaks their instructions into their phone, the system's artificial intelligence automatically converts that spoken audio into text, linking both the audio file and the transcript to the QR code.
We tend to joke in popular culture about terrible doctor handwriting, but medication errors during the dispensing process are a severe, sometimes fatal threat.
Absolutely fatal in some cases.
Right. If a pharmacist misreads a handwritten dose, or if a patient simply misremembers how many pills to take after a really stressful consultation, the consequences could be catastrophic.
It's a huge liability.
The product overview notes that this voice-enabled system leads to significantly higher treatment adherence. You aren't guessing what the paper says. You are hearing your own doctor's voice telling you exactly what to do right there in your kitchen.
And the application extends even further for specific vulnerable populations. The sources detail a variant they call med-safe pharmacy stickers.
Med-safe?
Yeah. Pharmacists can apply these directly to the dispensing boxes. This provides scannable audio alerts and digital dosage reminders.
Oh, that's smart.
It's designed specifically for patients who might struggle with traditional printed labels due to, say, visual impairments or cognitive challenges.
And the mechanism for those dosage reminders is brilliant because it still doesn't require an app.
Right, no app.
By utilizing standard web protocols, scanning the sticker can actually prompt your phone's browser to offer a simple calendar file download or an SMS opt-in. It just integrates into the tools you already use every day.
It's seamless. But the utility doesn't stop at the pharmacy counter. The sources also detail smart pathology and lab stickers.
Oh, I found this part fascinating.
According to the documentation, this links your biological sample directly to a patient receipt.
Okay, break that down for me.
So the workflow there is highly efficient. When you have blood drawn, the phlebotomist places a sticker on your receipt, you scan it with your phone, and you can actually track the diagnostic progress of your sample in real time.
No way.
Yeah. The system updates you through the various stages, so you'll see things from sample arrived at lab to analysis in progress, all the way to results sitting with GP.
That is functionally identical to tracking a pizza delivery on your phone, but applied to your own blood test.
That is an excellent analogy. And honestly, from the clinic's perspective, this level of transparency solves a massive operational headache.
Because patients aren't calling constantly.
Exactly. The sources explicitly state this reduces, quote, chase calls to the surgery.
Oh, right.
Just consider the sheer volume of administrative hours wasted by receptionists, simply fielding calls from anxious patients and having to repeatedly say, no, your results are not back yet.
Yeah, that's got to be draining.
By giving the patient a real-time tracking mechanism, you drastically reduce that administrative burden and you free up clinic staff for actual care.
But I do have a question here. Does moving the confusion from a piece of paper to an audio recording actually solve the underlying comprehension problem, though?
What do you mean?
Like, what if the doctor mumbles, or uses heavy medical jargon, or speaks with an accent the patient really struggles to understand.
That's a fair point.
If I just have a high-definition recording of instructions I cannot parse, the communication gap still exists, right?
What technology architecture actually accounts for that vulnerability through redundancy.
Redundancy?
Yeah. The system does not merely play a raw audio file. Upon scanning, the browser plays the clinician's original audio recording, but it simultaneously displays the transcribed text generated by the AI.
So you get both.
Yes. This dual layer of clarity completely changes the dynamic. If the audio is muffled or spoken too quickly, the patient has the text to fall back on immediately.
That makes a lot of sense.
And if the patient processes information better by reading rather than listening, or if they are hearing impaired, they have that option right there. It ensures the why and the how of the treatment are firmly understood, catering to different learning styles and accessibility needs simultaneously.
Here's where it gets really interesting. We have spent a lot of time discussing the patient taking a medication or a receipt home.
Right, the home experience.
But the sources reveal this technology scales up dramatically to handle complex internal hospital operations. It is turning passive hospital equipment and even passive patient wristbands into interactive, data-rich tools.
The internal applications are arguably even more critical. VocalTrace offers digital patient ID tags.
Like for their wrists.
Exactly. These are secure stickers placed directly on patient wristbands that link to vital medical records, blood groups, known allergies, and emergency contact details.
Wow, so all that info is just a scan away.
Yes. This is fundamentally about bedside safety. If a patient is unconscious, sedated, or otherwise just unable to communicate, any attending medical professional can instantly scan the wristband and access the patient's most critical health data to inform immediate treatment decisions.
That could literally save a life in an emergency.
Without a doubt.
And that functionality extends to the physical hospital environment itself,
Yeah.
right? The documentation outlines estate and equipment tags.
Yes, the equipment tracking is huge.
Imagine a really complex piece of medical machinery on a ward, like an IV infusion pump or a specialized heart monitor. A maintenance-ready sticker is applied directly to the casing. If a nurse on the night shift is struggling to operate it, or if a technician needs to service it, they just scan the sticker. It instantly provides access to digital operational manuals and CQC-compliant service logs.
The mention of Care Quality Commission, or CQC compliance, is a really vital operational detail there.
Why is that so hard for hospitals to manage?
Maintaining accurate, accessible service logs for hundreds of pieces of specialized equipment across a massive hospital estate is notoriously difficult, and it is highly prone to human error.
I can imagine. Lots of clipboards and lost binders.
Exactly. So a sticker that instantly proves a specific machine is up to code, recently serviced, and safe to use represents a massive administrative and regulatory win for hospital management.
We do need to address the physical reality of a hospital, though, because hospitals are highly demanding environments.
Very harsh environments.
There are fluids everywhere, constant chemical cleaning, and really high turnover.
Yeah.
Furthermore, physical security is a massive concern.
Sure.
A moisture-resistant sticker is useful, but if I have a sticker on my wrist linking to my severe allergies, my blood type, and my emergency contacts.
I see where you're going with this.
Yeah, what is stopping a random person from just scanning my wrist while I'm sleeping on the bus on my way home from the hospital?
The FAQ section in the product overview addresses both the environmental durability and the data security head-on.
Okay, let's hear it.
First, regarding the physical environment, these are not just standard paper office stickers.
Right.
They utilize a medical-grade, moisture-resistant adhesive. It is specifically engineered to remain secure on glass vials, plastic medicine bottles, and ID bands despite constant exposure to fluids and chemical cleaners in busy ward settings.
Okay, so they won't peel off in the shower.
Exactly. But your question regarding data security is really the most critical point of all.
Because we are talking about highly sensitive, protected health data flying through the air into a commercial smartphone browser.
Yes, but that data transmission is heavily guarded by clinical-grade encryption.
What kind of encryption?
Specifically, the system utilizes AES 256 encryption alongside secure HTTPS protocols.
Oh, wow. Okay.
Yeah, I mean, to put that into perspective, AES 256 is military-grade encryption. It is the exact same standard used by global financial institutions and governments to classify top-secret data.
Like what banks use.
Exactly. It would take modern supercomputers billions of years to brute force crack that level of encryption.
That's reassuring.
But to address your specific scenario about someone scanning your wrist on the bus, the system allows all sensitive data to be PI protected.
Oh, so the QR code alone is essentially useless without the secondary key.
Exactly. Even if a malicious actor or just a curious bystander manages to scan the QR code on your wristband or your medication bottle, the web page that opens will just be locked.
I-
It will require a specific PI to actually decrypt and unlock the transcribed text or the audio payload. This mechanism ensures that only authorized medical individuals, or you, the patient, can bypass that AES 256 encryption and access the protected info.
So what does this all mean? We have established this incredibly focused, highly practical solution. It's a highly secure sticker that stops you from misreading your prescription, tracks your blood tests like a delivery app, and secures your bedside data with military-grade encryption.
It's an impressive stack of features.
It really is. But when we look at VocalTrace's broader ecosystem in the source material, the scope of their ambition gets kind of wild.
It does expand quite a bit.
We start seeing connections to their parent research groups, and we realize this simple sticker is actually just the tip of the spear in a massive global cultural shift.
If we connect this to the bigger picture, we really have to analyze the affiliated organizations and the deep market research driving this product.
Right.
VocalTrace is deeply connected to Dowell UX Living Lab and Dowell Research.